I'm Justin Rice. I am a family physician with Franciscan Physician Network. My journey to become a doctor was a long one, like most people, but I had a lot of knee surgeries in high school and really was in doctor's offices a lot and loved what they could do for people. The science behind it was really cool. I think being able to help people in that way is really impactful. And as far as family medicine goes, I chose that specialty because I like taking care of the whole person and the entire family unit. I think that's a very nice way to do medicine. And I try to take a very holistic view on how I treat people, using diet, exercise, sleep, stress management, all the natural ways we can use to treat somebody. I like to try to prioritize those. Preventing disease, using these lifestyle factors, I think is very important and a great way to kind of go about treating people. The part of my job that I am the most passionate about are the relationships that I get to build with patients. I considered a lot of different specialties in medical school because I was interested in a lot of different things, but being able to see all these different disease processes and ages of patients and backgrounds of patients is really what I'm passionate about. And those longitudinal relationships are what really kind of bring me the most joy in my job. I think what drew me to Franciscan as far as a place to call home and to practice is just the values that define the organization. I think they're very patient-focused and patient-centered. Being a nonprofit health system and still being run by the sisters is something that I think you always have that North Star of patient care to kind of guide the decisions that you make, and that was something that was the most important to me as I was looking for a place to practice. So the one piece of technology at Franciscan that I'm really excited to use is something called Heidi, which is essentially like an AI-powered scribe tool. And it really just allows me to spend more quality time with patients, which is what I'm very passionate about, so I can be a better listener during those encounters and take better care of people. As far as hobbies for me when I'm not at work, I love to be outside. I'm a huge golfer, so I play at least 1 or 2 times a week during the spring and summer. I like to stay very active in general, so I like exercising, going on runs. I live here in Carmel actually, so I try to get out on the Monon as much as I can. And I have a very supportive family and friend network here locally as well that I try to spend a lot of time with. The one piece of advice that I would give my patients would be to be the biggest advocate for their own health. And by that I mean taking charge of your exercise, diet, sleep, stress management, all of those lifestyle factors that make you healthy.